have to discuss some spaces in the hand, actually towards the thumb side, thenar space, and then there is a mid-palmar space. There are other spaces also, one called as the radial bursa, which is along the flexor pollicis longus tendon, radial bursa, and one of them is actually the towards the other fingers, actually towards this side. So these four fingers, there will be another bursa which is towards the ulnar side, so ulnar bursa. Ulnar bursa is larger, having four tendons, and radial bursa is smaller, having one tendon, flexor pollicis longus. Let me show you some diagrams, then you'll understand four spaces. I'm telling you that towards the thumb you have the thenar space, and towards the little finger you have the mid-palmar space. It is in the mid-palm. Remember, if there is some problem with the index finger, that infection, say you are puncturing the index finger, there was some pus formation, that pus can enter into the thenar space. So pulp infection into thenar space from the index finger, yes, but if the other fingers are involved, like maybe the middle finger or ring finger or the little finger, their infections, these three fingers, infection will, pulp infection, pus will move into this space, which is called mid-palmar space. Remember, the lumbrical 1 canal, the lumbrical 1 canal, which is for the finger here, index finger, is communicating with the thenar space. But if you say lumbrical 2, 3, 4, then their canal, lumbrical canal number 2, 3, 4 will be communicating with the mid-palmar space. So first lumbrical is having a canal which is communicating with the thenar space, whereas the other three lumbrical space is communicating with the mid-palmar space. These are all MCQs. And as I suggested, that there is one flexor pollicis longus tendon, along that there is a synovial sheath, and that synovial sheath covering the flexor pollicis longus tendon to flex the pollex is toward the radial side, so we are calling it as the radial bursa. But if you are looking toward the ulnar side, you have ulnar bursa, which is quite large comparatively, because it is basically around the four tendons there, and continuing with the tendon of the little finger. So if you say it is continuing with the tendon of the little finger, what if there's a little finger puncture here, pulse phase infection? Then of course ulnar bursa will be involved. It is continuous with the synovial sheath of the little finger, the ulnar bursa. And what about the thumb, radial bursa? Radial bursa is continuous with the thumb there. That is the point. Also, there is a forearm space of Parona, and if you're talking about the forearm space of Parona in the forearm, then it can also be involved sometime due to a lot of infection here, and it can be communicating with the radial bursa, which is synovial sheath around the flexor pollicis longus, or it is actually communicating with the ulnar bursa, which is synovial sheath around the flexor digitorum tendons. Flexor digitorum tendons. So you're telling that flexor digitorum tendons are having some synovial sheath, that is ulnar bursa? Yes. Communicating with forearm space of Parona sometime, yes, infection can come there also. So these are some of the basics which we need to know about the hand spaces.